Hi, lab nursing staff. It's Amanda McAdam. I am the office nurse over at Arlington High School, one of the RNs with our team. And I recently got to go through SNAP and do a whole bunch of trainings and add some things which I think are going to be helpful for us as we move into welcoming students back. So this recording is a quick tutorial on some of the things that I've changed and updated and what the responsibilities will be for each classroom nurse, for each nurse at individual programs to chart on and change with their student population, and how to communicate back to the nursing team to close the communication loop about possible COVID-19 cases, confirmed COVID-19 cases, and COVID-19 exposure. So I actually have these written as objectives so that all of us can be on the same page. I'm hoping this will only be about 20 minutes, so we'll see how quickly I can get through this. Tried it yesterday, came back to do it again because I had to change some things for you, make it easier for you. Grab a pen or a pencil. I'm going to share my screen. And I'll be sending out the objectives ahead of time. So if you have them, you can write, little notes in the margin, or you can write on a separate sheet of paper. Okay, let's go here. And I am recording. Okay, good. Okay, I'm gonna move myself just a tiny, tiny bit. All right, so our objectives today for the updates are how to quick add a staff member using a staff designation, how to chart a COVID assessment using staff and student templates. We're going to review all of the templates and the actions that are within them, how to select COVID-19 as a condition, and how to delete COVID-19 as a condition, and how to use the state waiver templates for our yearly screenings. So we're going to go first to how to quick add a staff member. I'm going to log in. And we are recording this. So if you are trying to do this in Snap, trying to follow along, or if you end up having trouble the first couple of days when you come back, you can come back to this. It's going to be on YouTube. All right, so let's go first to how to add a staff member. So we will need to add staff members when we are charting on people this year if they ask us to assess them or to advise them based on symptoms that could be COVID-19. Previously, we haven't added all of our staff members. I had a generic last name member, first name staff at my site at Arlington High School, and then I would just write in who that person was that came to me, if I gave them ibuprofen, if I gave them Tylenol for a headache, whatever it was. But at this time, if a staff member is asking us for either advice or for a quick assessment based on symptoms that could be COVID-19, or if we hear that a staff member has been exposed to a known case or has been sent home because they were sent themselves home because they were experiencing symptoms, we will need to add them in. This is so that we can track how many possible cases we have, and so that we can track how many of those possible cases actually come back as a COVID-19 presumptive positive or positive diagnosis. So I'm going to show you guys how to add a staff member. I've created a whole new designation for each one of the schools so that we're not charting them in something that would show up as a student. And it will quickly create a thing for them. They're not going to show up on our immunizations or anything like that because they're a student. They're not assigned a grade, all of those good things. Okay, so when we come in to select a student, we have this option here, quick add. That's what we're going to do. We're going to add Jane Smith. For teacher, we're going to say staff. For grade, we're going to say STF. Oops, she's female. For date of birth, staff may or may not give you their date of birth. They might not want to share any identifying information. That's fine. You can actually put that they started in whatever year they started. Let's say they started the 30th of January 2016. Make sure you don't classify them as a student. Make sure you classify them as staff in whatever school you are at. All right, so now we have Jane Smith. So again, we do a quick add. We put in their last name, first name. We designate them as staff, whatever school. Date of birth is not applicable. Student ID, totally fine. Then you have to click OK. All right, so now let's look for Jane Smith. Here she is. And a quick note, you know that if you want to delete a record, you can take them out as inactive here, right? Okay, so you can do that. But we're not going to be doing that for the duration of this health scenario, health crisis. All right, so this is how we add a staff member. Now, some people might ask, well, can you give a staff member an anonymous name because staff members don't want their names being listed? I think what staff members have to trust, they have to trust the nursing team. We need to have people's names because otherwise it's going to mess with our numbers. It's going to mess with our number counts. And we need to be reporting those numbers back to our town public health nurses for each one of our districts. So we can't anonymize them. It's not going to go beyond the nursing team. To our administrators, what goes is just a list of no information of number of cases. The nursing team is the team that holds the names. And so we need to be responsible with that. We need to be responsible with that information. Our staff need to see us modeling a culture of confidentiality and calm. We need to radiate calm and confidentiality. So I would just encourage staff that it's going to the office nurses, it's going to Sasha, Amanda, and Janelle, and it's not going to anyone outside of the nursing team. So they need to see us, modeling that within a classroom environment as much as possible, that we are guarding their confidentiality. And we can let all of our staff know that they can communicate that directly to us and let us know, hey, I tested positive. It's actually written into the updated contract between the union, the LCA, LCEA contract between the union and lab, that all lab staff will responsibly report or are responsible to report if they have tested positive to COVID-19. So, okay. Now let's go look at our templates. Okay, so we're going to chart in Jane Smith, and then I'm going to go back and I'm going to delete her because we're going to be done with her. But I'm going to show you the templates that I created. Okay. All right. So we're going to chart on her. All right. I designated some assessment templates for us. All of the ones that are connected to COVID are, let's see here, are designated with the number 1. So this is absentee investigation. Actually, Sasha created this one. Ooh, good job, Sasha. Absentee investigation, if a student's been out for several days. Contact tracing, that's going back and kind of looking through, if we get a positive case, who everybody was that was reported. Actually, you know what? Let's just pretend like we're doing all of them, okay? So here. This is absentee investigation. All the COVID-19 ones are designated with the number 1, so they come up at the top of our template menu, okay? This is a case management. We're investigating where they've been out. We're gonna write in how many days. And then they're gonna report to us if they had a positive test result and it was reported, then they're gonna report it to us. If they didn't, guess what? We can delete that. Yes, I'm gonna delete that, okay? If they did, though, we're gonna note it. And then we're gonna do a health interview. We're gonna ask them, what were you exposed to? Was it a communicable disease or was it a contact exposure? Is that why you're at home? So anytime you're using a template, please just come through, delete the things that you don't need to do, okay? All right, we're going to provide some education to the parent guardian, talk about infection prevention, we're going to talk about hand washing, we're going to talk about social distancing, all of these things. So this is just going to be a quick intervention. This was probably a phone call. So we would say that at the top, and we called the parent guardian to ask why they were absent for 3 days because we hadn't seen them and nobody told us. Dun, dun, dun. All right, I'm going to delete that one. Let's move on to our next template. We're still going to use Jane Smith because she's useful. All right, here we go. Contact tracing. You double click on a template to use it. All right, so we did get a report on a positive test result, COVID-19. And so now we actually have to look back and we have to see who was in that kid's classroom. So here are the people, the exposures, who were the staff that were in that classroom that day, who were the students who were reported, who were in that class that day. This is important. For in-school collaboration, the administration, that's going to be your office nurse. So if you're at Lexington High School, Belmont, Burlington, Bedford, if you're in any of the high schools other than Arlington, then you're going to be reporting that back to Sasha and to Janelle. If you're at an elementary school level or junior high level, then you're going to be reporting that back to me. So the in-school collaboration administration, you're going to be letting us know who tested positive and letting us know that you've written up a note to your knowledge of the staff and the students who were exposed on the day that is within 48 hours. So the 2 days before that person either went home or tested positive. So if they went home with symptoms, it's the 2 days before. If they tested positive, it's the 2 days before. Or it's 2 days before they became symptomatic. Yes, 2 days before they became symptomatic. And then you as a classroom nurse, you actually don't have to worry about this part, the public health clinic or communicable disease agency, so you can delete this. Because that will be follow-up that Sasha, myself, and Janelle will be working on. And then you're going to follow up with any of the health promotion, any of the things that you facilitated. Did you talk to your staff about like, hey, here's how we're preventing the spread of disease. We're hand washing, we're social distancing, all of these things. You can add any other interventions that you completed at that time. So that's the positive test report. All of these templates can be changed. I've actually changed them a couple of times. So if something's not working for you and you need a different one, then go ahead and reach out to myself or to Sasha and we can work on that. All right, so we did contact tracing. This is presumptive and positive. Oops, I did not double click it. Okay. All right, so let's say that we heard back, we sent a kid home from school yesterday to there, and we said, you need to go see your primary care physician, and they need to do a test on you, or they need to look at you for symptoms. They saw the doctor says, you have all the hallmark symptoms. I'm presuming you are a positive case, so you have been clinically diagnosed. And the doctor decided, you know what, it's not even worth it to do a test because we're low on tests or whatever. Or the doctor said, no, we're going to do a test, and then they get the positive test result back. All right. So for your purposes, you as a classroom nurse, this is the most important thing that we are doing here. It's the in-school collaboration with the administration. And again, that is to your office nurse. So that's to Sasha or Janelle or myself. And this one, case management, communicable disease, is important. Please don't delete this one, the case management, communicable disease, COVID-19, because this one actually triggers a risk management flag in SNAP, and we can use it to run different lists. So that's one of the ways that we have of keeping track of everything, and I'm going to show you another that is important. But it is important that you are not doing this one. So again, you don't actually have to worry about the community agency, the town public health nurse, unless somebody has reached out to you and asked for case numbers, unless you've become a contact and a person who's reaching back and forth with community agencies or with the town or public health nurse. And again, with this one, you probably are not going to have to worry about that. So we've left these on here in case they end up being useful in the future, but you may not need to use them. Two important ones: in-school collaboration administration to let your office nurse know, and the case management communicable disease. Okay, a few more. Bear with me. Okay, follow-up same day reporting. Okay, this one I'm going to go through with you. This is assessment follow-up same day. This will be if you assessed a staff member or a student and you sent them home or you sent them to the doctor, and you may or may not have completed all of your follow-up charting in that full assessment. Let's say you didn't. You have another option to come back and do a follow-up template afterwards. So the problem was you suspected they have a communicable disease, COVID-19, you're going to put in here. It's an assessment follow-up same day. And sometimes, almost every time, it's going to be easiest for us to track who that student or staff was exposed to that same day. We're going to look at who's been in their classroom, who's been on their bus, and we're going to note staff and students. And again, this is the part where it's important for us to be that culture of confidentiality and calm. So we're not going to be reactionary. We're not going to run around and say, oh, we need to know everybody who the student came in contact with. We're going to look at our vans. We're going to talk to somebody who knows that that child or that staff was excused. We're not going to spread this information that that child or that staff was excused. It's possible if that staff was somebody who's on a van run, is a van monitor, that somebody had to be tapped in to fill their position. So some of the staff are already aware. And that's an easy way for us to find out, okay, which van were they on? Which classroom were they in? If they moved from classroom to classroom, if they were a support professional, then what schools were they at today? And so calmly and confidential, preserving as much confidentiality as possible, only talking to people who know that that staff or student were excused, who were in the need to know bubble. We're going to write down, what room number they were in, the people that we know who work there, the students that we know who were there. We're going to do our best. All right, so we're going to say staff exposed, student exposed, that we referred them to their primary care provider, that we recommended testing or an assessment. And the in-school collaboration, again, that's going to be your office nurse. And we are going to write down, let's say that we sent them home and we forgot to remind them about the exclusion policy. Then we are going to come back to that. We're going to call them or email them and make sure that they know what the exclusion policy is. How many days would they have to self-quarantine? So again, Sasha just did a big addendum to all of our health policies. The most recent information is in that addendum, which was attached to the health and safety screenings that was sent out last week. And pages 5 through 19 have the updates. And there are many of them. Off the top of my head, what I can tell you is if we have positive tests, then the exclusion policy is from 10 days of when that person became symptomatic, okay? 10 days of when they came symptomatic at the minimum, 10 days. And they must have 3 days, no fever, and with bettering symptoms. And they can't come back with active secretions and an active cough or worsening cough. So that's going to be, and they're going to need a doctor's note and to have contacted their local town health department before they can come back if they have a positive test. If somebody was exposed to a negative test, the most recent update is this. If somebody was exposed to a positive case, the most recent update is that even if they test negative, they still have to self-quarantine for 14 days because of the discrepancy in some of the sensitivity of some of those tests. Not all of those tests are giving us a full picture of if somebody is positive or not. But for the full reference, go back to pages 5 through 19 or reach out to your closest office nurse and ask us, hey, can you remind me of the exclusion policy again, staff and student? All right. Delete this. And I'm not going to take you guys through the full assessment for staff. I am going to show you the full assessment for students. The full assessment for staff is similar to the student one. So this one, a full assessment, is the student one. Staff full assessment is a little bit different because it's not quite as detailed, because with staff, we're not going to be, looking for rash or different things. But I do want to show you a few things that we have added to the SNAP library. We added the problem, the suspect communicable disease, COVID-19 assessment. This was a case management assessment referral from teachers. The teachers asked us to check this kid. We did add in disposition, if the kid's wearing a paper surgical mask or a homemade cloth face mask. So again, you're going to delete whichever one of these does not apply. Let's say they're wearing a cloth mask. So we're going to delete this one. They're wearing a cloth mask. We were called to the scene. The staff requested that we symptom check them in a designated area. We're going to look for the big ones first, right? We're going to look for level of consciousness. Are they lethargic or drowsy? Are they short of breath? Are they breathing rapidly or shallow? Do they look unwell? We're going to be looking for those big ones that clue us into an emergency. So let's say, they look sick, but they are not short of breath that we can see. They're not breathing rapidly that we can see. And their level of consciousness is fine. They're able to sit up, they're able to answer some questions, but they do have a fever, okay? And they don't look great. So they do have a fever. They have 101 Fahrenheit, infrared. And then for our kids, we've all heard about the COVID toes. So I did add those. Blotchy red spots on toes or red patches on the soles of the feet. They might not have that. And they might not be able to tell us if they have lost a sense of smell, but maybe the staff reports they did not their favorite foods times 2 days. So they didn't eat chicken nuggets for 2 days, and that's rare. And they can't tell us about their new loss of smell. We're going to listen to their brush sounds. They might be diminished. They might be wheezing. We might see some accessory muscle use, or maybe we don't. Yeah, actually, I do want to get rid of that. They're a little diminished, a little wheezy. They have a cough, non-productive. There is a rash. There's a rash on their trunk. And then we would describe what it looks like. Some of our kids are actually showing us like those viral rashes. We look in their throat, it's a little bit red. Maybe they don't have discharge. And then any vomiting or any diarrhea. No vomiting, but let's say they did staff reports stools times 3 today. Okay, so they're obviously sick. We will be excusing them. We're calling the parent guardian or the emergency contact if we couldn't get a hold of the parent guardian. This parent was great. They picked up their phone. We're doing some case management. Remember that case management, communicable disease, is the one we do not delete. We're doing in-school collaboration with our office nurse. We're not going to worry about this. We're going to follow up on that later. Yes. We dismissed them from school due to suspected COVID-19, and we dismissed it to our parent guardian. Okay. So that is the student assessment. And again, the staff assessment is similar to this one, but it's less detailed because staff are not going to be like taking off their clothes or all of these things. Mostly staff are going to be kind of going through a checklist of symptoms if something occurs on that day. Okay, so we're going to lock later and delete it. All right, so those are the templates that we've created. And now I'm going to move on. Now we've done how to quick add a staff member, how to chart a COVID assessment. We reviewed all the templates and the actions within. Now let's go here to Jane Smith and let me show you. So let's say that we just had a phone call. We just charted in our templates that we received positive confirmation that Jane Smith has a positive case. She's been diagnosed, okay? So we need to come here. This is important. This is going to be the way that we are keeping track. All of the office nurses, Sasha, Janelle, and myself, are keeping track of our case counts and running lists so that we can easily report any case counts to the town nurses. So we are going to be running reports and lists every Friday or at the end of every school week. And reporting those back to our governing school, to our governing public health agencies. So everybody, all of the program nurses, whatever school you are responsible for, you're responsible for going into their student record and designating if you have heard of a positive diagnosis or a presumptive diagnosis. The same thing with staff. If staff have reported it to you, you are the one who's responsible for going in and setting this condition, okay? So Jane Smith, we did hear that she has a COVID-19 positive diagnosis. And do this, and we're gonna click save. And that's it. But now when we come here to her record, under conditions alert, she shows up here. And this way, when we are running lists on our sides of things, we can easily see how many people are in each school. And we'll actually get lists that are generated at the end of every week, which is great. Now, what if you need to take this off? Because Jane Smith, she was diagnosed. She went through her 10 days from the start of symptoms. She was cleared by her doctor. We have a doctor's note that's saying that she's ready to come back. She has touched base with her local public health governing agency. She's ready to come back. So we can actually go back. We can make sure that it's blue. We've highlighted it and we can delete it. Are you sure you wish to delete the condition? Yes, we are sure. Okay, so we're going to delete. Goodbye. She's all clear. It's been resolved. Yay. All right. So that's how to designate a condition. Like I said, it's very important. One of the most important things, actually, because otherwise we're going to have a lot harder time trying to keep track of all of this information. And this is the easiest way for us to control that flow of information and for us to run those lists quickly. So please, if you have questions about anything, this is the part that I really want you guys to get. Okay, great. All right, one last thing. We're almost done. Screenings. So just as Sasha mentioned in her email, we got state waivers for our screenings this year. Yay, which is wonderful. And so I've actually created for us some templates for our state waivers. Let's come here. All right, so you click on new, and now let's come down here. Some of our kids end up being due for everything all at once. So let's say all of their state screenings were due this year for some reason, because of their age, because of their grade level, okay? So we have this. Screening type, vision was waived, hearing was waived, Postural was waived, height, weight, and BMI, they were all waived. So because it's set on within normal limits, if you come down here and you put check defaults, it's going to come up with this. It was waived due to social distancing for the 2020-2021 school year. That's it. Check defaults, click OK. Now it shows up. State screening waiver for all of their screenings. All right, I'm going to actually delete that one because let's say that Jane Smith, she actually wasn't due for all of them. She was only due for BMI because she's a high school student. Height, not screened. Weight, not screened. Calculate BMI is non-applicable. Again, we're going to come right here to check defaults. It's going to say due to social distancing, 2020-2021 school year. All of them are filled in. We just check defaults and we click OK. Ta-da! That's all we had to do. So this actually will be very quick and will be very easy. A very easy way for us to come in and say, no, we didn't do our screenings this year, but we have a record of that. We have documentation of that, and we have documentation of why. Again, I'm going to delete this. Yes, and click OK. All right, for Jane. Actually, she's right here. I'm going to delete Jane. She's no longer active. And click OK. She's going to be removed. All right, so hopefully you guys all learned something. We learned how to quick add a staff member. We learned how to chart a COVID assessment, and we went through some of the templates. We learned how to select COVID-19 as a condition and how to delete it as a condition. And we learned how to use the state waiver templates for our yearly screenings. You guys are awesome. What a great team. Feel free to reach out to me if you think of some templates that you really need. Then go ahead and reach out to me or Sasha and we can add those in for you. Or if you have any questions after watching this video, please let me know and I can check back in with you. Okay, bye guys.